Good afternoon, Renee.
Hi, good afternoon.
Have a great meeting. Good
Thank you.
afternoon, Jackie.
Good afternoon.
Have a great meeting. Hello, Leslie.
Hi, how are you?
Good, how are you?
All right,
Good, have a great meeting.
thank you.
Good afternoon, Josefina.
Good afternoon.
Have a great meeting.
Thank you, Rhonda.
Good afternoon, Keith.
Hi, Rhonda. Good afternoon.
Have a great meeting. Good afternoon, Supervisors Median.
Good afternoon, Rhonda. Am I coming through loud and clear?
You sure are. Have a great meeting.
Thank you for your help.
You're welcome. Good afternoon, Mr. Lorenz.
Hi, Rhonda.
Have a great meeting.
Thank you.
Good afternoon, Supervisor Lee.
Good afternoon, Rhonda.
Have a great meeting.
Thank you. How loud do I sound? Because a lot of times people think I'm not very loud here. Can you hear me okay?
Yeah, you're a little bit light, but not too terribly bad.
Okay, I'll try to speak louder.
Thank you.
Thank you.
Good afternoon, Supervisor Chavez.
Hi, Rhonda. Thank you.
You're welcome. Have a great meeting.
Thanks.
Good afternoon, President Wasserman.
Good afternoon, Rhonda. How are you?
I am fabulous.
Yeah, nice.
I have a new friend that I got today.
You got a new what today?
I got a new friend.
Oh, look at that. That,
Cute.
Elvis is in the building.
that,
So cute.
that looks great. Enjoy. Do you have a name?
Yes, his name is Elvis.
Albert?
Elvis, E-L-V-I-S,
Got it. Elvis.
like the king. Elvis is in the building.
Oh, yes. No, I know all those people are known by their first name.
Yep.
Like us, Mike and Cher, all the same.
Yeah,
There you go.
exactly. Exactly.
Supervisor, your clerk today is going to be Jill.
Jill, thank you very much.
You're welcome.
Just a courtesy announcement that we are live on the internet.
Wonderful. Thank you very much, Jill. And although we didn't adjourn, we recessed. We still want to take a roll call, and we'll do a pledge of allegiance led by Supervisor Chavez after the roll call.
Thank you.
Do we have Supervisor Simidian?
Yes, indeed.
Do.
You are there, sir. There you are, sir. Thank you.
Good afternoon, Supervisor Lee.
Good afternoon.
Present.
Present.
Supervisor Chavez.
Here.
Supervisor Simidian.
Here.
Vice President Ellenberg.
I'm here.
And President Wasserman.
Present.
Thank you. You have a quorum.
Thank you. And with that, I'll ask Supervisor Chavez to lead us in a pledge of allegiance. Anybody who can stand, please do so. Then we'll go into public comment.
I pledge allegiance to
To the flag
of the
United
United
States of America
and to the
and to the republic
for which it
for which it
stands,
stands,
one
one
nation,
nation,
under
under God,
Indivisible.
indivisible,
and justice
with
for
liberty
all.
and justice for all.
Not a barbershop quartet. What would be a quintet? I think that's it. All right, Jill, let's move on to public comment. I see one speaker at this time. So I'm going to allow that speaker 3 minutes. Please go ahead.
Okay, one moment. Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. I'm beginning to think that we are, that we're going to run the mentally ill and homeless that were kind of left out during the pandemic, that we are going to run them through the criminal justice system. A couple of people that I advocate near where I stay at have been getting nightly tickets. They've been pulled out of their vehicles, tickets from, littering to campfires, to registration. A lot of these people were told to shelter in place and kind of remained where they were at. I truly believe that we should be getting them on their way by helping them get their vehicles going, kind of assessing them a little better than what we are. A man out on Spring Street, he's right there at Columbus Park. We have a lot of similarities. He was a business owner a long time ago, resident of San Jose, and he lost his vehicle due to a bad tow. He kind of fought the system. He filed complaints, and the system retaliated against him. He lives in a van out there. He has mental health issues. He has a lot of problems that I truly believe the system has caused this man. We don't have the ability to make him whole, and we just let him basically rot and melt in his van out there. Behavioral health hasn't made it out there. The county hasn't made it out there. And all this man does is just get harassed. There's another woman that's down near the corner of 7-Eleven. She has some really bad mental health issues. She's in that Whole Foods 10 by 10 tent there that's wrapped in saran wrap. I didn't see the woman for 3 months. She finally made it out of that tent yesterday, going through a psychosis, absolutely losing it. She got into it with the handicapped man that sleeps at the bus stop right there. And it was an interesting thing to watch, what was going on. The woman was pulled in, she was put on a hold, and the city showed up this morning, less than 24 hours from when they pulled her in. They used snow shovels and they basically threw all that woman's belongings away. Her photographs, her just basically everything she had there. It's just a slab of dirt now. That is cruel to do to people. This young man that I talked about, Sean, they're just waiting for that time bomb to go off. They're trying to say that he's not going to sign tickets, which of course he'll sign them. They're waiting to pull him in. And once he goes into the Santa Clara County Jail, then they're basically going to signal the cleanup crews or the city, and they're going to go through and take this man's belongings. And then when he gets out of jail, it's going to just be right back into the same situation. These people are like cars that sat for a long time. You got to kind of prime the oil pump. You got to drain the gas tank out, change the spark plugs. These people are the same.
Talking about the county of Santa Clara, how much of a diversity, how much of a different companies, organizations, government organizations, nonprofit organization, community-based and development organization, and as well as so much of enrichment with the religious organizations are there in the county of Santa Clara. County of Santa Clara is just not a county which is just providing a reference in terms of a state of California or within the United States of America, where it's being said that the county of Santa Clara is just a county. County of Santa Clara has been visited by the prime ministers of different countries. It's been visited by the different ambassadors of different organizations of different countries as well. There are so many international trade markets, embargoes has been exchanged within the county of Santa Clara with the different organizations and as well as the chief executive officers of the organizations. When we talk about the two sets of people, one, the people where the county of Santa Clara gets benefits from is the organization as well as the people bringing the business to the county of Santa Clara. Talking about the other side of the people, where the people who requires the help, talking about the immigrants and non-immigrants. On both the sides of a people, there are people who are in need of food, who are in need of a shelter, who are in need of a clothes, where the different organization comes together as a part of under one shelter of a government and gets the required funding and grants and being benefited for the betterment of the life of the people living in the county of Santa Clara. Looking at the other side of the people, where the different business are being conducted and being evaluated with the different set of people, business-minded people coming together and conducting the business and providing the enrichment to the county. Now, between both the sides, there are also a set of people which requires to improve and also control and mediate the different issues that are being arising in the county of Santa Clara, which requires to be handled by the right set of a law enforcement and order and implementation of a bill, Senate and Assembly bills. Thank you very much.
That concludes our speakers, Mr. Chair.
Thank you, Jill. That moves us on to item number 13, which is review of the county executive's fiscal year 21-22 recommended budget for departments reporting to the Health and Hospital Committee. Vice President Ellenberg, did you wish? Yes, you did. You've got your hand raised. Go right ahead.
Thank you. I appreciate that, President Wasserman. Since we are formally continuing the meeting from yesterday, I want to just make some further general comments on the American Rescue Plan before we get to individual department reports. We did have a bit of a discussion yesterday about how we might each prefer the funds to be used, and that's what I'd like to follow up on. I have had the chance to review in a little bit more detail the allowable uses of ARP funds and wanted to share some thoughts with my colleagues. The stated purpose of the funding is to address the impacts of the COVID pandemic, including the economic impacts. Overall, the messaging from the federal level is quite clear that we should prioritize funding to benefit low-income, minority, and tribal communities that were disproportionately impacted by the pandemic. A few specific restrictions on the use of funds are called out, and that's what I want to sunshine today. And if I have misinterpreted any of the language, I will look to Dr. Smith or James Williams to correct me. First, as I understand, the funds cannot be used for pensions. I agree with Supervisor Simitian that this is an area that warrants our close attention, but I don't believe we can address that issue with ARP funds. Secondly, the funds cannot be used for capital improvement projects, except for projects specifically tied to the COVID response. And you'll recall that we made fairly extensive rapid investments in the hospital to accelerate capacity creation, and those expenses may qualify, but unfortunately, we can't apply funding to the pre-existing backlog of capital improvement projects, as was discussed yesterday. I want to call out a few potential uses that are allowable, and I think important for us to consider. First, there are many ways ARP funds can be used to bolster children and families in our communities, specifically early childhood education, childcare, broadband infrastructure projects, broadband reimbursement to families, and direct relief payments to families presumed to have been impacted by the pandemic are all appropriate uses for these funds. We've also done so much work as a board to support small businesses, and I'm pleased to see that we can use ARP funds to further bolster this sector through grants and loans. Premium pay for essential workers in impacted industries is also an allowable use of the funds. We can allocate funding to nonprofit organizations that have been impacted by the COVID pandemic, and I'm certain my colleagues are aware of the drastic needs expressed by our community-based partners through the inventory funding requests and the letters from the Silicon Valley Council on Nonprofits. Overall, I'm glad to see the broad range of allowable uses for this one-time funding that goes beyond the medical response, testing, and vaccination budget placeholders that we inserted at mid-year. And we have a considerable amount of time to make thoughtful decisions as to the allocation as the funds only need to be allocated by December 2024. They can be spent as late as December 2026. Of course, I'm not advocating for holding on to the money 1 second longer than necessary, but just wanted to add these thoughts and perhaps some parameters, and looking forward to hearing the outcome of the conversation at FGOC later this month. Thanks, President Wasserman.
Absolutely. And I don't see any other hands, so I'm sure this will be an ongoing discussion. I recall back in the days when we voted for the lottery dollars and to benefit schools. And lottery dollars were raised and they went in to benefit schools. And then the state took an equal amount of money out of the money that was going to schools and used it on other stuff. So I'm sure there's all kinds of ways to spend the dollars as is appropriate. And I'm sure the geniuses that make up our administration will come back with several recommendations in the months ahead. Having no other speakers or public comment, we'll now resume back to 13, start A through G. Dr.
Good
Smith,
afternoon.
can I start with you on this, or are you going to Greg?
Greg's going to do this.
Okay, Greg, go right ahead. Mr. Ituria.
Okay, good afternoon, President Wasserman, members of the board. This is Greg Ituria, County Budget Director. And today we will review the recommended budgets for departments reporting up through the HHC and PSJC departments. When we will begin with health and hospital system departments. The first budget to review is the MADD Emergency Services Fund. This is a relatively small budget for emergency service cost authorized by Senate Bill 12, and the recommendation is to maintain the current level budget for next fiscal year. Similarly, another relatively small budget is our Children's Health Initiative budget, and we recommend maintaining the current level budget for next fiscal year as well. And then for the Santa Clara County VMC and clinics, our hospitals and clinics, we have recommended actions for the board's consideration to add resources to expand the ICU capacity at the main campus, the Bascom campus, and to support the growing inpatient census projected for VMC at O'Connor, as well as for the St. Louis Hospital in South County, and resources to improve access for our outpatient clinics as well. It also includes funding for the Roots Community Health Clinic services, as well as augmentation of physician services at the county's reentry center. And it provides resources to improve our community clinic partnerships oversight. And the general fund investment for the VMC hospital maintains at the amount that was approved just at this last mid-year, a little over $213 million investment in that system. So at this point, President Wasserman, I don't know if we want to pause for questions here, do a few more.
Why don't you keep on going?
Okay. Next is the recommended budget for the Community Health Services Budget Unit. And this is a budget unit that is the oversight and administration is still our hospital and clinic system. And at this point, we're recommending the beginning of the transfer of the clinics contracts to VMC budget, with the thought that next year we'll kind of complete that integration of the Community Health Services Budget Unit with the Hospital System Enterprise Fund. And that is the only, so no change in services is recommended. The overall funding is the same. For the Public Health Department, the recommended action is to add resources to continue and expand the Asian Pacific Islander Community Worker Program, and to redirect resources directly providing the violence prevention program for underserved youth. And as the board is aware, there's also been recent discussions for how to acquire and apply additional federal funding for public health that has been on a separate track, and obviously will be added to these resources. Next, for the Custody Health Services budget. Oops, I see a hand up. Should I pause here?
We have Supervisor Ellenberg. Yes, we'll do public comment after it's all done. But Supervisor Ellenberg has a comment.
Yes, I have some comments and questions on the public health. Do you want?
Sure, I just thought we'd do four items and then have Q&A on that, and then do the other 4 items and do Q&A. Thank you.
So this is the appropriate time for questions on public health?
Right now he's doing Valley Medical Center, Community Health Services, Custody Health, and Public Health. So as soon as he's done, yes, he's just finished on that. Thank you, on Public Health. Yes, Vice President Ellenberg, it is.
Thank you. Thank you very much. And thanks, Greg. I appreciate the enhancement of some core department capacity through the state grant approved at our last board meeting. And given how critical we've seen investments in public health to be in preventing communicable diseases and environmental emergencies, and addressing the health outcome disparities and racial equities that have been exacerbated by the pandemic, I'd be interested to see how we can build department capacity outside the ongoing reliance on state and federal grants. Even prior to the major grant expansion last week, public health was more than 50% funded by grants and fees. This fiscal year 2022 proposed budget for public health has a net cost to the county, in other words, a subsidy of $73.7 million for the department as a whole, inclusive of expansions due to COVID, whereas the VMC investment is proposed at $213.8 million. And while both departments certainly include COVID-specific costs, over the past 10 years, the VMC investment has averaged 188 million, and in no year was it less than 87 million. VLF and tobacco settlement revenues make up part of the VMC investment, but I would expect that they would also be allowed for preventative health and public health services. So issues of departmental capacity and workforce development were addressed as part of the Harvey Rose audit this year of public health. And when that report is heard at FGOC, I would be interested to see planning toward gradual buildup of resources over the next few budget cycles to prepare for a time when federal or state grant funding may drop off, but the local imperative to support these core services and guard against future emergencies will clearly remain. I'd also like to hear discussion from my colleagues today about how we might address that issue. Last August for the FY21 budget, Harvey Rose had recommended a board policy to limit the amount of VMC subsidy as a percentage of general fund revenues and essentially put the hospitals on a plan to gradually reduce reliance. I don't know that that's immediately feasible given the large mobilization of VMC still for COVID, but perhaps some multi-year approach to gradually shift resources from VMC healthcare delivery to public health department prevention, or possibly a board policy that would benchmark relative levels of general fund in VMC and public health to assure that we are emphasizing prevention and very early investment and intervention. So I'm interested to know if there's broader interest in this. We could direct a discussion of strategies here to HHC or to FGOC relative to the public health department audit review when it's agendized. I'm happy to pause for a minute and hear if there are any thoughts on that. And then Supervisor Wasserman, I do have a couple of other different comments on this department.
All righty, I'll look for other hands, or Dr. Smith, if you want to comment at all about the distinction or delineation, I guess, regarding funds for VMC versus public health. Supervisor Chavez, your hand is raised.
I would like to hear from Dr. Smith too. I was going to ask a clarifying question.
I guess the best I could respond in very general terms is that funding sources for both departments come from a number of limited streams. So for example, VMC, the majority of their funding comes from patient care, Medi-Cal, Medicare, other services rendered. It is true that much of public health has been funded in the past with grants of various types from the state and the federal government, usually related to some specific expenditure, and then filled in with the general fund. And obviously the board has discretion over a relatively small part of the general fund. So certainly these are policy decisions that ultimately come to the board to decide how they want to spend that relatively small discretionary portion.
And Dr. Smith, wouldn't it be fair to say you can't cap VMC?
You can't cap VMC unless you're willing to basically either turn away patients or fire staff.
Yep.
Because the problem we have with reimbursement from third-party vendors or third-party insurance and Medicare is it only pays up to a certain amount, and because we provide care for anyone, no matter what their insurance is at any time for whatever services they need, there's always going to be some general fund subsidy. We've spent quite a bit of time in the last 10 years trying to decrease that subsidy, and we're very successful. The reason it bumped up again this year has to do with the purchase
The
of
purchase.
O'Connor and St. Louis. And the
Exactly.
fact that, there's been a lot of deferred maintenance and additional staffing that needed to be placed at those hospitals. But I will say that particularly St. Louis is turning around really quite well, even in the pandemic. And O'Connor's holding its own. Most hospitals across the nation lost a lot of money during the pandemic because most private health systems are set up to make money off of certain lines of business that are elective surgical procedures, and those decreased considerably. However, in our public system, our revenue sources are not disproportionately rewarded based on elective cases. We're here to take care of anybody and everybody for no matter what their need. So even though our revenue was challenged, we can expect through state changes and the continuation of the 1115 waiver, and because of the efficiencies we built into the consolidation, that we'll be able to bounce back considerably faster than the private sector.
Thank you. Appreciate that. Supervisor Chavez.
Just to make sure I understand what Supervisor Ellenberg is asking. Susan, are specifically, are you wanting to shift internal resources to protect public health long term, or to grow it? I'm not sure I understood exactly what you were saying.
Thank you. I'm happy to clarify. Sorry that wasn't more clear. I am looking at an adjustment over time, obviously not to cap patients or our capacity, but somehow we've decided, maybe not consciously or intentionally, that it would be okay to underfund public health for a long time, while always making sure that our hospital system what was really at a make whole at all cost level. And I don't want to shun or discredit the hospital at all. What I'm thinking about is investing more in preventative care, in early intervention. I think we do an outstanding job across our hospital system, providing care to people who are ill or injured or suffering from chronic conditions. I think we don't do nearly as much as we could as a county on the upstream end of preventative measures, proactive, pro-social programs and services that promote health and ideally avoid people needing so many hospital costs down the line. That's what I'm thinking about.
That's super helpful. And Supervisor Ellenberg, I think that part of the reason I'm so excited about the Office of Children and Families is that I think one of the challenges with being the safety net is that that we're there to catch people before they fall, and all the way to the ground, although we people get dangerously close and to that. And I think a big part of what you're talking about is more broadly I think setting a policy around how we invest in prevention. And what's interesting to me about what you're raising is that I think that that public health is certainly one of the preventative departments, but I frankly think that we have opportunities and mechanisms for prevention throughout the organization. And one of the things that I personally would be really interested in seeing the board prioritize as a board is a turn of the ship to be able to quantify that which we are investing in prevention relative to all the other services that we're providing that are in the more safety net realm. And I would actually argue that between the prevention and the safety net, there's a whole opportunity for interventions too, that it would be important for us as a board to have a shared and with senior staff have a real shared understanding of what that looks like. And so I appreciate the discussion. I think that as it relates to the healthcare system and the hospital system, I think that when the board when Dr. Smith first came here, I think that was a big discussion for the board, which is, how do we take the resource that we're using, frankly, on the heaviest end, or not the heaviest, it's actually not, but that end of the organization, and be able to share it with other parts. I think what is missing is this idea that we're going to have a strategy relative to prevention overall, and frankly, that this is department by department. The only thing that concerns me is you're not doing this, but even as we're having this discussion, I'm trying to be mindful of not using language like pit one part of the health system against another part of the health system, because that's really not what you're talking about.
No.
Much longer and in a much more rigorous way, not unlike the way we spend a certain percentage of our budget for parks and open space. What is our commitment going to be long-term to prevention? And yeah, so I concur with you. I think the approach should be much larger. And the other thing I would say is, I don't think it just has to be general fund dollars, because I think the idea of us being able to not use federal or state grants, or federal or state investments is more challenging, because I think that we're never going to be able to do that. But I do think that we can leverage those resources more aggressively to be on the prevention end. So thank you for that discussion.
Thanks. I appreciate that, and absolutely share the vision that this is not a one against the other. And in fact, I strongly agree that so much of the prevention work will be in SSA and other departments, not solely in public health. But I do think that it would be very interesting for us collectively as a board to develop an overarching strategy around prevention work.
Supervisor Lee. And then back to Chavez, it sounds like.
On a different topic, thank you.
Sure. Supervisor Lee's had his hand up. He just needs to unmute.
Thank you.
There you go.
Yes, thank you, President Wasserman. Yeah, so I completely agree with my colleagues' comments regarding the importance of funding our public health department, and the preventive care is really what we're focusing on. I mean, as we know, the last president has gathered funding on pandemic prevention, and look where we're at right now. And I think it is so crucial to make sure that that we, Santa Clara County, is going to be prepared and ready for it. I'm really excited to see the CEO recommendation to add resources to expand our ICU capacity at VMC, as we could see how important the ICU capacity was and how close we were to add capacity to zero for those few days in January, and how can we forget that? And also planning for the fact that we're going to have growing inpatient census at both at O'Connor and St. Louis that we just purchased a couple of years ago. I think those are really extremely important priorities. So I want to commend our staff for working on that. As far as the funding for, as my colleague mentioned, prevention, intervention, and safety net, I think all those three, we never pit those against each other. Those are all important issues, and I certainly look forward to learning through the budget process of how we could beef up those processes that we have. Of course, one of the most important things that we've been able to accomplish last couple of years to improve our finances is our computers system to be able to better track and able to get a lot of the reimbursement back from state and federal sources. So I would certainly want to learn more to see how we could also beef up our preventive services as well. Of course, as we all know, prevention is always better than cure, and that's absolutely the sage advice to look at our budget as well. Thank you.
Thank you, Supervisor Lee. And before I turn back to Supervisors Chavez and Ellenberg, Supervisor Lee, I appreciate you bringing up what was bullet number 1 on page 8, expanding the ICU capacity at VMC Bascom. We were looking into that, but now there's a direct tie to COVID, because we were stuck in tiers and we were very close to having a real problem when the ICU beds that we had prior to pandemic were always fine. But the ICU beds we had once we had the pandemic were right on the precipice of not being sufficient to be able to provide appropriate beds for people who were sick. That could also be a use of the rescue funds that come our way, expanding the ICU beds in the hospitals to prevent a repeat of what happened a year ago. Thank you. Supervisor Chavez, you wanted to speak on other items. Supervisor Ellenberg, were you done on this item before we move on to other items?
I'm finished with that subject.
Okay, why don't you move on to
in this department?
Yeah, why don't you move on to the next subject that you wanted to comment on?
Okay.
And then when we're done with supervisor comments on these four, we'll ask Greg to speak to the other three.
Perfect, thank you. This specific area that I want to talk about is
We're
Black
hard time hearing you.
Oh, you are?
There you are, that's good.
Okay. One specific area that I believe that we really must expand investment is in our Black infant health program and the related perinatal equity initiative.
I'm sorry, Supervisor Ellenberg?
Yes.
And I'm seeing other hands go up. You're back now to being hardly audible.
Okay, I don't know what to do about that.
If you can move a little bit closer, you were fine. And then when you sat back, it was very weak.
How's that?
That's good right now. Yes, thank you.
Okay, I won't move. Thank you. So the area I want to talk about where I believe that we really need to make additional investment is in our Black infant health program and the related perinatal equity initiative. And I'm confident that public health also prioritizes.
Supervisor, I need to stop you again. And Supervisor Midian, I assume that's what your hand is raised for?
Okay.
Yep, the same reason. Yeah, perhaps we go to Supervisor Chavez at this time and then work a little something different with your machine in one way. Is that all right? We'll
Yeah,
come back to you.
I don't know what happened. I haven't changed anything.
I don't know, but you're definitely further away and then a little staticky.
Okay. See if I
From the host, we might suggest you check around your mic. Sometimes papers get pushed against your computer. Other than that, there's not more I can troubleshoot from here.
Right. Let's go to Supervisor Chavez and we'll come back to Supervisor Ellenberg. Maybe pay your PG&E bill and we'll work something out. All right. Supervisor Chavez.
Thank you. And I want to make sure I'm covering the right areas. Just to concur, we've covered A, B, C, and D. Is that correct?
I have us as B, C, E, and G. So why don't you speak about whatever you wish to speak about?
You know what? I think what I'll do is I'll just wait till the staff gets through the whole presentation. I want to make sure I get to hear everything before I comment. Thank you.
Sure, that's absolutely fine. Supervisor Ellenberg?
Anything different? No?
No, that's good.
Okay.
Nope, that's not good.
God damn it. Sorry. Hopefully you didn't hear that. Now?
You're staticky for some reason.
I'm gonna look out and just come back into the meeting. And
Nope, that's not working. We'll come back to you. Greg, why don't you go ahead and finish the last three items under 13? Then we'll hear from the public. Then we'll come back to supervisors, starting with Chavez and then Ellenberg and anyone else who wishes to chime in.
Okay, so Mr. President, the next item is the Custody Health Services Budget Unit. And the recommended budget for custody health is 103.2 million. This includes the implementation of the second phase of the Custody Health Services restructure that was began earlier this year. And it also includes aligning our cost recovery estimates for their services based on recent cost trends. And the recommended budget for behavioral health services is 608.8 million. It includes 7.9 million in recommended actions to add resources to enhance permanent supportive housing services and to further support the electronic health record implementation. There are recommendations to reduce budget allocations for service agreements to align with more recent cost trends. And because these are only for alignment to cost trends, there is no anticipated service impact from this realignment. For the emergency medical services budget, there is a total recommended appropriation of $7 million. And this implements the fiscal year 21-22 annual EMS trust funding spending plan. It reduces the allocation for services and supplies to align with cost trends. And it deletes a no longer needed vacant half-time warehouse materials handler position. The recommended budget for Valley Health Plan is a total recommended appropriation of $684.5 million. It includes recommended actions related to the transfer of funding for facility improvements at the Silver Creek campus, but otherwise maintains the current level budget through next fiscal year. And this concludes the presentation of the recommended budgets for those departments reporting up through HHC.
Thank you, Greg. I think the confusion, and I know we had it in my office and kind of reorganized things this morning, was what's on page 3 of 4 of the agenda under item 13 is the A, B, C, D, E, F, G is not in the same order as the PowerPoint slide.
Yep, I see that. That's, yes.
Yeah, it kind of jumped around a little bit just to test our alertness. But we all passed and we are on board. We're going to go back to Supervisor Ellenberg now, and hopefully we'll get a clear reception.
Okay, how are we now?
Good.
Good? Okay, if it falls apart again, I will dial in for the sound.
All right.
So still on public health for the moment, and talking about the Black Infant Health Program and the related perinatal equity initiative. I know that public health also prioritizes this issue as it was selected as one of their 3 performance metrics as a department. I've attached a memo to today's agenda to sunshine my intent to bring forward a referral for expanded program capacity and partnerships with external health system partners to address the African ancestry maternal health crisis. Should the referral be approved, administration would need to provide a specific staffing plan and budget, but I would expect that the level of county funds should be brought up to match the state grant resources at about $800,000 per year. In clarifying with County Council, it is most appropriate to agendize this new proposal for board action for the next meeting, but I wanted to raise it now so that administration can anticipate this investment as a potential addition for the June revised budget. Last year, and just several other pieces that I wanted to add. Lastly, at the mid-year budget, I'd expressed concern about board and public visibility regarding the trade-offs administration has had to make in diverting staff from some program activities to respond to COVID or disrupted services due to social distancing requirements. And of course, this is an issue across several areas of the county organization as a whole, but maybe most acute for public health programs. I'd like to ask administration to provide an informational report on or before the first day of the June budget hearings to provide a snapshot in time that indicates at the program level, and thank you for using that in this budget, which county programs are currently modified or suspended due to either the redirection of staff to disaster service workers or they cannot provide services due to social distancing requirements. And to be clear, I think these decisions are fully justified, but it's also important for transparency with regard to our budget, where we're approving budgets for programs that may still be substantially impacted for appropriately setting board and public expectations about service levels as well as to inform any future planning of ways to mitigate the service interruptions. I also had comments, Supervisor Wasserman, on custody health and mental and behavioral health.
Please.
Thank you. With regard to custody health, I am in full support of implementing phase 2 of the custody health restructure. After some early miscommunications and cross communications on process, I want to particularly thank Dr. Day for her leadership and diligent work to align department operations with the needs outlined in the consent decree. I also want to appreciate the department's acknowledgement of the impact that a reduced inmate census has had on services, and have noted the budget reduction they've made in response to lab and pharmacy services. I'll be bringing this issue up during the PSJC next PSJC discussion, as we consider where else we might reduce spending in response to decreased inmate populations. I realize, of course, that some costs are fixed, but there are also many that are driven by population size, and that's where I'll want to focus. And then with regard to behavioral health, just quickly first on the addition of resources for NetSmart implementation, Greg or Dr. Smith, could you remind me of the timeline for implementation of this system, including for our contract providers, and whether any of the new resources will be used to provide support for contracted providers?
I think Sherry can give you a better timeline.
Great.
Sherry,
Hi, Sherry.
are you there?
Yes, I'm here. Good afternoon, Board of Supervisors, Sherry Terrell with Behavioral Health. We did go live with our NetSmart My Avatar implementation last fall. And so we are continuing to work in partnership with our contract providers around NetSmart, looking at implementing a pilot in July or August of this year with one of the agencies. So we're continuing to work with all of our contract providers around NetSmart, and looking at what additional supports and resources are needed there.
Thank you so much. Would you include updates on this work through the HHC monthly reports on the progress, so I can just track it that way?
Yes, we can do that, Supervisor.
Thank you so much. I've also heard, and I'll stick with Sherry for a couple of minutes, some concerns about potential reductions in mental health urgent care clinic hours. Are there operational changes that are not reflected in the budget? And are there options in place to ensure that there's 24/7 access for crisis services for residents at the urgent care centers?
We're currently working on looking at the hours at urgent care, and that's part of what we've been discussing with staffing over the past several months. We are ensuring that all of our resources that are available to the community are still available. So our mobile crisis response, emergency psychiatric services are all available 24/7, and we continue to work with urgent care around the needed hours to be able to ensure that those resources are available to the community.
Thanks. When you say the needed hours, is there a goal of 24/7 for the urgent care clinics, or something short of that?
We're continuing to examine the current utilization of urgent care, and can provide the board with any information that you may need with respect to urgent care.
Thank you. I would then like to request an off-agenda report that shows what the utilization is of the evening and later hours, and how we would determine if it would make sense, and if there's a need to operate 24/7 at those sites as opposed to the mobile emergency.
Sure, we can provide that.
Thank you. I think, and I'm certain you agree with me, that it is critical that we invest in a well-coordinated system of crisis response services, and that we continue to build out and align the tiers of the PERT, the Mobile Crisis Response Team, and the Community Mobile Response programs. Closely tied to the success of these programs and all of the adult intensive services, of course, is really strong outreach and linkage to care infrastructure. This has been identified as a key part of the discussion around possible adoption of AOT in Santa Clara County. And frankly, I believe that if we had a robust enough linkage to care system right now, court mandated treatment very likely wouldn't be a focus. Other AOT program providers spoke at the HHC special hearing, emphasized this outreach and motivational interviewing work by providers as being the most important tool in getting clients to accept services. And I worry that we haven't utilized every single ACT slot, and that the pandemic may have impacted how we effectively get new clients with severe mental illness into care, and required us to work on decompressing inpatient settings rather than fully implementing ACT as envisioned. And again, I understand that the needs of the pandemic required that shift temporarily. And when it comes to AOT, I continue to have strong reservations about placing mental health care in a justice system setting, and the stigmatization, the potential chilling effect on asking for help, and the disproportionate impact on BIPOC communities. I appreciate that some funds have been set aside for future behavioral health programs, but if a majority of this board votes to implement AOT later this month, a full complement of outreach supports, intensive treatment slots, and housing supports will all need to be accounted for, so that we don't risk adopting a policy, but then under-delivering on the most important part of the conversation, which is effective treatment. So to those ends, I want to make two requests for when this issue is brought to the board on May 25th. First, that the plan include a robust accounting of projected costs, inclusive of not just the program infrastructure, as was reported to HHC, but also the related outreach, treatment slots, and housing costs. Second, that the plan include a recommended structure for oversight of AOT utilization and demographics of referrals and services, including monitoring for disproportionate referrals of BIPOC residents to court-mandated treatment, preferably with community or external oversight. And finally, I know that, and should I pause there for Sherry or Dr. Smith to acknowledge those requests?
I think we should have Dr. Smith respond at this time, because we're talking about the budget for the departments. Dr. Smith, go ahead.
I was only going to comment about the issue related to AOT, and as the board knows, the supervisor knows, we have a placeholder of $4 million for changes in behavioral programs. From a staffing perspective, we think it would be more wise to spend that money on increasing the number of IMD beds in the county that are available, because we clearly have a shortage.
Yep.
But the board will have the opportunity to discuss so-called Laura's Law AOT. And obviously the board will decide how to spend that money. But just getting my 2 cents in, IMD would be much more useful for the community than AOT.
Thank you. And Supervisor Ellenberg, you had one more topic you said?
Yeah, thanks. And Dr. Smith, I agree with you, but I am anticipating if that is not the case, that $4 million very likely is not going to cover it, especially with the estimates of the number of people being as high as 150 or 200, as was reported in the HHC hearing. So I know we're discussing it more on May 25th, but because we're talking about the HHC budget, I wanted to highlight that I don't think that would be sufficient if that's the direction the majority of the board chooses to go. And I know that this board continues to prioritize behavioral health services, including the expansion of adult intensive services, community mobile crisis, school-based behavioral health, the launch of Alcove, and other priority projects, all of which are more important than ever. given the behavioral health strains, frankly, on our entire population over the past year. But the reality is that the board, and I'm including myself, also authorized cuts to vacant behavioral health positions, 12 in June of 2020, 9.5 in August of 2020, and in addition, 43.5 behavioral health staff left through VSIP. So altogether, we have 47.5 fewer positions today than we did a year ago. And while I know and appreciate that this budget does not propose any new cuts to positions, and thank you for that clarification, I am concerned that we may not have sufficient capacity in this department to execute all of the high priority projects and grow the level of community services that we and our residents are expecting. And the concern is reinforced by findings in the BHSD audit about historical underspending of resources, timely implementation of MHSA innovation projects, and underutilization of treatment spots in our current adult intensive services. The audit found that behavioral health was underspending by 9 to 12% per year for several recent years. We've had discussions this past year and recommended now for FY22 about right-sizing contracts. And there are, in my view, there are two ways to solve underspending. We cut budgets, as we have done, or we expand outreach and connections to care to utilize the funds that have been allocated to us. VMC appears to have taken the latter approach with the proposed budget to grow the pie rather than cut. And I would like behavioral health to have the flexibility to put those resources where the needs are and not have to second guess individual contract amendments or add deletes of staff. But I want to say that we as a board need to commit, I think we have, but I don't know if we need to reformalize it, commit to higher levels of investment that reflect the priority that we're placing on these services, especially in the next year as we come out of COVID and expect higher levels of the need for supportive services for many segments of our population. I think this is a critical area for consideration of our use of federal COVID relief and recovery funds, including rebuilding infrastructure for services to operate more effectively in contracts for short-term service enhancements, cutting staff or contracts while also expecting higher volumes of service and more innovative models, I fear is unrealistic and maybe counterproductive to what the board has prioritized. So I'd like the administration to bring back a proposal in June, in the June revised budget, that augments behavioral health resources to fully support project management and implementation of all the projects underway for timely delivery of new programs, and that boosts adult and youth outreach for services as residents emerge from COVID over the next 12 months, including in school settings. And I would ask also administration to provide an informational report for the June hearing that reports on the available resources for behavioral health through federal relief funds, utilization of the MHSA reserve, and expanding services to maximize Medi-Cal reimbursement and any other options to increase core department capacity and service levels. And aren't you glad that my sound is working again?
Oh, yes. Supervisor, if you can take a break for a minute. Dr. Smith, did you or one of your assistants or the video capture all that Vice President Ellenberg has said as far as what she wanted back in May, what she wanted back in June? Do you
Yes, we've got it.
Okay, wonderful. Thank you. Supervisor Ellenberg, anything else before I turn things over to Supervisor? No, that's all. Take the note. Supervisor Chavez, you're on.
I am. Thank you very much. Let me start with just a huge gratitude for the whole county staff, just really putting pedal to the metal during COVID-19. But the backbone of it is really the groups of people we're talking about today. So I'm gonna, and I apologize, this may be a little jumpy because my numbers are different than Greg's, but so let me start with Valley Health Plan. I just wanted to say how much I appreciate Valley Health Plan getting out of their expensive lease and going into a county-owned building. Bravo. Under both Valley Health Plan and under the public health and our health and hospital clinic system, Dr. Smith, I have a request that I'm curious about your thinking on it, and that is that all of our different departments have really performed admirably, and I've been briefly seeing news and commercials for Walgreens really pitching in and helping with COVID-19 and UCSF and Stanford. And I haven't seen anything like that relative to Valley Medical Center, our public health department, or Valley Health Plan. And I am very interested in two projects. And I'm, again, curious about your thinking. One is, I think it's going to be very important to codify the work done by the county during COVID-19 and to have a real robust record. And then second is, I'd like to better understand if there's a plan to communicate out sooner rather than later the role that the counties played in addressing COVID-19. The reason I think this is so critical, colleagues, is that we have a sales tax that we put out in 2012, a bond we put out in 2008 for rebuilds of parts of the hospital. And, you know, and we have a very, you know, these are public resources that we've been spending. So I both want to make sure we have a really robust record, but also that we're communicating our work on behalf of the community with our residents. Dr. Smith?
Dr. Smith.
Supervisor, it's true, we do need to let the community know more vigorously what the county's been doing. Prior Deputy County Executive David Campos, who has experience in San Francisco, used to tell us that San Francisco is really good about telling people what they're going to do, but not very good at doing it. And Santa Clara is very good at doing it, but not telling people very well what we've done. So we hear that, we understand it. We're trying to develop a communication plan which will let the public know how deeply we've been involved in the response.
Thank you. And as part of the revise, what I'd really like to request is that the appropriate level, and I don't know what it is, of resource go to the VMC Foundation to actually develop a project to record the role that the county played. And I just want to acknowledge how many women and leaders of color have really led this effort. I think it is critical that we capture that. So please consider a very discreet resource to the foundation to do that historical work and make sure that it's memorialized. Thanks. Thank you.
Thank you. Supervisor Ellenberg, your
Supervisor Wasserman.
I'm sorry.
I'll go
Supervisor Chavez, I thought you were done. Please
No,
continue.
I apologize. I'm going to go through each letter as quick as I can. And I like that you did it in a group, so I'm going to go through the group even a little out of order. I do just want to say also how much I appreciate the work being done by Custody Health. And with public health, I just want to reiterate that I do think there are two areas that I want to make sure that we have an opportunity to consider prior to the final vote on the budget. One is that I am interested in knowing who on our staff is playing a leadership role within the public health department that is focused particularly on air quality. And the reason I'm asking that question is I have not seen us play a leadership role outside of, in a very good way, vaping and tobacco management, tobacco cessation. But I am interested in us having an assigned person to deal with air quality, in particular because of the significant impacts that we see with communities of color based on air quality, and with climate change, I think that's only going to get worse. So, and with fires. So if within all of our, the staffing, if we could designate the one or two people, I'd be interested in learning about that again prior to our final vote on the budget. The other issue that I do think I would like to just hope that this goes under public health long term, and that's around period products and the opportunity to make those available countywide in all of our county buildings. And again, I know we're expecting a report in August, but I'm hopeful that we can get at least an update before the June budget, as it may have a financial impact. So those would be requests. On behavioral health, Dr. Smith, I'm going to ask you this question instead of Sherry. And that is that the staff has done a very good job of trying to quantify the investments we're making in behavioral health and what the waiting lines and lists look like. And we had a chance to see a portion of that at the reentry center, our reentry meeting a couple of meetings ago. And I'd very much like to make sure that the board gets an off-agenda report that demonstrates the waiting list for our services in each of the areas that we're providing services. For example, there's a really great chart that shows what the service, how many days, how it's available, how many people use it annually, and even in some areas what the waiting list is. But the reason I think that's important for the board to see is the point that Supervisor Ellenberg raised about how we're matching resources available to deltas in need. I think would be really critical for the board to see, again, prior to, I know this budget in June is one of many budgeting sessions we're going to have, but I think being able to understand that clearly enough to be able to give feedback to what should be invested in particular while we're having the discussion around AOT, I think would be beneficial. I think a lot of the work's been done, but I think having it before budget would be ideal to the board. Dr. Smith, do you have any thoughts or concerns about that?
No, we'll get that to you.
Thank you. I too wanted to just weigh in on the IMD beds. I think I am very interested in, again, off agenda, getting the number of IMD beds, Dr. Smith, that you think are going to be necessary. And I think one of the challenges is I do not think AOT and IMDs are, I don't think they necessarily go in the same bucket of service. They could. I think that's a fair point, Dr. Smith. But I think we know that we have a delta of IMD beds in the county. And we know we need them, and we know we need safe places for people who can't care for themselves. So the number and the assessment that's been done, I think would be very valuable to come to the board as a separate item. Just a separate informational item. I think it will help with these discussions.
Sure, we'll be happy to do that.
And then the other thing I wanted to raise is that, with the wellness centers I was speaking about the other day, I want to make sure I decouple the wellness centers, the mental health wellness centers, from what I'm referring to as rejuvenation centers. And we have VHHP is, they're looking at a wellness center. Sherry's team is also designing wellness centers countywide for mental health wellness. But the rejuvenation center that I'm speaking of really is for people who are chronically homeless, who need a place to get stabilized so that we can try to get them connected to services. This is particularly true for the hard to serve people. And I really want to ask that, again, before the end of budget, that the wellness center that VHHP is discussing and this rejuvenation center, and even the services that are being provided at the sobering station be laid out in like a chart so everybody understands the difference. And then Dr. Smith, if you could help us understand how and what you're prioritizing for those, that would be really, really helpful. I think, again, it will allow us to have a more robust discussion about what we're doing for the homeless population and people who are severely mentally ill.
Will do.
Thank you. And then just for my colleagues, I wanted to highlight that under behavioral health, one of the issues that I'm really concerned about is chronic absenteeism and what I think is going to be a dramatic expansion of that in the fall timeframe. I will also be bringing forward a referral relative to chronic absenteeism, and we'll discuss it also as part of the district attorney's budget, but I just wanted to sunshine that for my colleagues. Dr. Smith, I understand that our emergency medical services, our EMS contracts are limited because they aren't allowed, those rigs aren't allowed to bring people directly to the sobering center. And I wondered if that is an area that you've been discussing with our contractors, our contractor for EMS.
That has to do with regulations about transport at the state level. We can give you an off agenda to explain the limitations we have. It basically boils down to a requirement that there be a capacity to do medical care at any place that a person is dropped off, unless there are special services. So there are ways we can work around it. So we'll have to explain it in a off agenda, I think.
Yeah, I think what I wanted to understand, Dr. Smith, from, just from you and the team is whether or not you think there's value to us changing the structure of the sobering station in order to allow for that drop off to occur, like if we have to get a higher level of licensure. And if so, is there value to that? So I think that would be great if you could let us know off agenda. I recognize that it's more complicated than meets the eye, but I was very interested in your thinking about whether or not that would be a significant asset that we should consider.
We'll delve into it and get it to you off agenda.
Thanks a bunch. And then, I'm also, I just will remind you, I do really, I can't remember if we ever got an EMS timeline for whether or not we needed to do a new contract, but I'm really interested in that, and relative to another issue, which is whether or not the hospital to hospital transfer activity needs to be done in-house, just because of cost and flexibility, given now that we have 3 hospitals and our partnership with multiple clinics. And I wonder, again, Dr. Smith, is that something that's come up as part of any internal discussions?
Yes, we've been planning for release of an RFP. I can't give you the exact dates, but the way we're going to structure it is such that the response can be from any qualified vendor, including governmental entities, and that would allow for hospitals and or fire or anybody else to respond to the bid. The issue that you bring up about inter-hospital or intra-facility transfers is a little different. The RFP that the board responds to and contracts for is really for only emergency services with an ambulance contractor. The inter-facility transports are done individually, and the county has historically contracted for that service, but certainly could consider doing it internally.
Yeah, and Dr. Smith, I was more curious about that because whether or not the volume had increased to a level that may make sense for us to do it internally. And, sometime in the August, September timeframe, I'd love, again, to get something off agenda, or maybe through Health and Hospital, just to do a check-in about your thinking on that. And again, it mostly had to do with volume, and maybe we saw more of that because of COVID-19, but it did make me curious about whether or not that made sense for us to play a leadership role in that, and also was it more efficient for us to do it? I don't know the answer to that. I'm genuinely just curious about what your staff's thinking is.
We'll get you a report back in that time frame.
Thank you. And then I did want to just do a quick check-in on this, that I hadn't seen in the budget the Health and Hospital leadership team related to the expansion of the gender-based violence identification and response team, and also the strangulation pilot, making that permanent, and the resources that need to be attached to that for our partners. And also, just wanting to make sure that before the June revise, that we see both the money relative to the strangulation pilot program becoming permanent, and also the leadership resources that are going to be required. Oh, and Dr. Smith, and also on the Child Advocacy Center, the technicians that are needed, and the district attorneys that are going to be needed to manage that site. If are you planning on bringing that back as part of the June revise for both of those sets of positions?
Yes, the CAC changes have been worked on, and you can expect to see them in the June revision. Some of the other subjects that you're talking about, we're going to take a little bit more time to get details, but as I mentioned yesterday, this is definitely not going to be a static budget this year. There's going to be many bites at the apple.
I think the one that we don't have time on to wait is the strangulation pilot, because it's already being expanded. So there is a $750,000 investment that we're going to need to make in partnership with I think it's not just our CBOs, but also for training. So if you could give feedback to that in particular prior to the end of budget, and I understand the point you're raising about the senior staff, but that senior staff component would be helpful to have at the August 17th meeting, just to get a sense of where you are in process with that.
Yeah, this strangulation is also in the works.
Great, thank you. And I'll just say this to my colleagues. I was sharing with Dr. Smith today how much I miss the Timpani Center, and it hasn't been open, and that as the work goes on with the reinvestment in the campus out there at VMC, that I'm very hopeful that we maintain that heated public pool for folks who are not necessarily part of our severe rehab, but people who we want to keep out of the hospital. There are so many seniors that rely on that and have been missing it. And as we get to yellow, I know I'm going to start getting calls for people saying, when can we get back into that rejuvenating tub? So I'll just leave that, and thank again the staff for all the work that was done on this portion of the budget and the work you've been doing with COVID. Thank you, Supervisor Wasserman.
Absolutely. Thank you, Supervisor Chavez. Now we go to Supervisor Lee.
Thank you. Can you hear me?
Yes.
Okay, very good. I don't believe we have covered behavioral health yet, right? So I will save those questions after.
Yes, we have.
Oh, we have? Okay, I'm sorry. So let me go ahead and ask the questions as well then. First, on custody health, I just want to first say that thanks for the good work this year. I understand that we did have a pandemic outbreak within our custodial facilities back in the January timeframe, when the COVID was very high, and that they were able to get it under control and move to where we are now. And the fact that with the consent decree that is watching over us, these 13 new positions that's being created or being improved, being added, will be extremely important to better serve our custodial residents. And I just want to mention that certainly support these operations. I look forward to these being implemented, and hopefully we could get our custodial health in a better shape than it has been, given the lack of resources and whatnot. Regarding the issue of behavioral health, I fully agree with colleague Supervisor Ellenberg's point that with the deletion of the 45 position from VSIP, and it seems like looking at the numbers, this is one organization that has one of the highest vacancy rate and currently has approximately 110 vacant FTEs. That's close to 15%, right? And so these are just really, really amazingly high numbers to have a functioning organization with the necessary people doing the job. So I just want to make sure that we are able to go back and fund the organization properly, because if there's anything that we have learned from this COVID pandemic, is that our need for mental health of our community in all communities, all ethnicities, has been extremely high and only increasing. So I just want to say that this is something that I'm very much concerned about, and want to make sure that we are not only funding it properly and making it in post haste to make sure that we really are putting forth these initiatives to help our communities. We are, of course, we are still concerned about some of the reimbursement from, what amount is being able to be reimbursed by FEMA, which ones could be charged to ARP. But I certainly want to be cognizant that advising our staff to be aggressive in terms of coding these items to be reimbursable, obviously, as much as we can. Of course, the more we can get reimbursed, the better for us in the future. Yeah, okay. And I think that's so far the questions I have. Thank you.
Thank you very much. Jill, we've got 3 members of Supervisor Simidian. Then we'll go to the public.
Thank you, Ms. Chair. Just a couple of quick observations over the item 13 list. I would just say, I think at some point we are going to have to come to grips with financial circumstances at O'Connor. I think we knew when we acquired 2 hospitals that it would take us some time to get them squared away. That proved to be the case. And then, of course, we had the further complication of the COVID pandemic. So I think, frankly, it's hard to wrap our arms around just where we are or are not in getting O'Connor squared away, but I think it's going to require continued attention. And I just wanted to sort of underscore that concern for our administration. I think while I was not prepared for the subject of AOT/Laura's Law to be the source of significant discussion today, I'll just say this. Since the subject has come up and both one member of the board at least and our county executive have spoken to it, I think it should just be on record that the item came to our Health and Hospital Committee with a recommendation from staff against opting in and recommending an opt-out. We not only heard the issue at HHC, but then scheduled a special meeting specifically devoted to and exclusively devoted to discussion of AOT/Laura's Law. We had probably 3 hours worth of conversation there with 20 speakers and 2 nonprofits who are providing AOT/Laura's Law services in San Mateo and Alameda County, and ultimately on a motion by Supervisor Lee and seconded by myself, we sent the item forward to the Board of Supervisors with a 2-0 vote in favor. And of course, other board members have yet to weigh in, and we'll have that conversation at the full board before a decision is made. The only thing I want to do other than get that information into the record, since the subject has come up today, is ask Dr. Smith, are we in fact seeing this item on May 25th? It's a subject of significant concern, and I just want to make sure that the public is aware of when the issue will be before the full board and that we can communicate that with some certainty.
Yes, the item will come as it does from subcommittee to the full board on the 25th for the board to make a decision.
Thank you very much. That clarification, Mr. Chairman, and the sort of ongoing concern about the financials at O'Connor were really just the 2 issues I wanted to highlight. Other issues have been addressed by colleagues or were addressed in the budget document itself or in conversations my office and I have been able to have with staff. Thank you again.
Thank you. We'll go. Nope. Supervisor Lee, your hand is still raised.
Actually, I meant to lower it, but I certainly want to say I echo what my colleague Supervisor Suminian says about the Laura's Law discussion, and we really look forward to have it come into our board next meeting. Thank you.
Thank you. With that, Jill, let's bring the three speakers on at 2 minutes each.
One moment. Our first speaker is username guest. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon. It's Elisa Kofkinsborg with the Behavioral Health Contractors Association. I want to, on behalf of all the providers in our association, commend the strong commitment to behavioral health services that is reflected in this proposed budget. I want to focus my comments on the item regarding funding to implement the county's new electronic health record. It's certainly been a long journey to get to this point, and community providers are just beginning the process of preparing to implement the interface with the new county system. As providers estimate the cost to implement, depending on which system they currently have, their costs for preparing their system for interface, making adjustments to codes and fields in their current system, staff time to do so, and training of billing staff. We've reached out to and are in discussion with Director Terrell and department staff regarding these costs. I hope that sufficient information on the process will be available so that the complete cost for this phase, including provider costs, will be known before the budget is finalized. We ask that one-time and increased ongoing costs resulting from the county's new EHR system are considered to be part of the county's EHR implementation budget. We will continue to work with Director Terrell and her staff. And again, we thank you for all your strong commitments to providing behavioral health services to county's residents. Thank you.
Our next speaker is Sparky Harlan. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Sparky Harlan, CEO, Bill Wilson Center, and ditto what Elisa said about the impact on our behavioral health contractors on our IT to interface with NetSmart. We've been told there'll be a one-time cost and ongoing cost to Bill Wilson Center that we weren't planning. And when I brought up at the stakeholders leadership group for Mental Health Services Act, they brought it up to us that Mental Health Services Act IT can only be spent for county funded IT. So we need to come up with a different source to help CBOs. I would also talk again about our ongoing infrastructure related to COVID and how we deal with mental health ongoing. And telehealth is here to stay, but we need help to beef up that software to be able to serve more for behavioral health. Supervisor Lee made the comment about 15% vacancy rate. Well, that's because our workforce, we're competing for the same few workers. We need to develop our workforce so we have more, and we need to think more creatively, including telehealth as a way to reach out. So I welcome having these discussions with the Behavioral Health Department and how we can address the shortfall in our workforce for behavioral health. Thank you.
Thank you.
Our next speaker is Urvish. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much to all the Board of Supervisors. First of all, I want to mention about the Valley Health Plan. And as a county, as an organization, and being a stakeholder, as well as the employee of the organization, what is most important aspect for an employee or a stakeholder is to consider that how they would be able to benefit from the health plan. Secondly, what are the different resources that is being offered by the Valley Health Plan versus, the different resources that is being available externally versus the resources available internally and being provided to the employee or the stakeholders by an organization. For an organization, it is important to retain the employee or as well as, provide the right set of benefits, and also to ensure that every medical plan that is being provided to the employee, say for example, the Santa Clara County that has been served by the Valley Health Plan over 30 years. Now they are also providing the commercial health maintenance organization owned and operated locally by the County of Santa Clara. In this particular case, it is important to note that the locally based health plan being able to provide the services, essential services, health services, and the benefits for the employees. Providing a different external resources plans would also benefit the county in terms of setting the right set of a budget for an organization, and as well as provide the different resources to the employees as well, and which is also allowing the employees to select different resources within the organization. Thank you very much.
Thank you.
That concludes our speakers.
Thank you very much, Jill. With that, we are going to move on to item number 14. Greg, I'm going to ask you to do them in this order, which is the order they appear in the agenda. And that is the DA, the PD, then pretrial, then criminal justice.
Okay. I believe that's the order of the slides, but we'll see as we go.
Great.
Okay, so this is the recommended budgets for the public safety and justice departments.
Yeah, we wanted the, yes, go ahead. Thank you.
Okay, Office of the District Attorney. And the recommended budget for the Office of District Attorney is 159.2 million. And it includes actions to enhance consumer and environment fraud prosecution, as well as the public law enforcement integrity team, both offset with the use of restricted funds, as well as shifting some of the 2011 realignment services to, again, to maximize outside funding sources to maintain services in the district attorney budget. And the next, for the Office of the Public Defender, their recommended budget is 75.7 million. It includes an augmentation of resources to maintain expungement services, post-conviction services, and community outreach services, expand the pre-arraignment representation and review, and to further streamline their customer service unit. For the Office of Pretrial Services, the recommended appropriation is 13.3 million, and it includes recommended actions to enhance administrative support, as well as augment service to the electronic monitoring program to reduce caseload and increase capacity for risk assessment. For the criminal justice system-wide cost budget unit, it includes the allocation of resources to support contracts in the Office of Reentry Services and their educational program. For the Office of the Sheriff, the recommended budget is 188.1 million, and this includes funding for 20 cadet positions to fund the Sheriff Academy, Sheriff Deputy Academy, and adds resources to enhance fiscal support, administrative management, as well as for their identification and unit and information services, and provide resources for the West Valley Patrol Division and their Court Security Division. And the recommended budget for the Department of Correction includes recommended actions to fund 20 cadet positions for the Correctional Academy, as well as increasing funding for their training and to enhance fiscal support resources for information services. And did you want to pause there or keep going, Mr. President, to cover probation?
Yeah, we went further than I wanted to do, so why don't you just finish us off at probation and medical examiner.
Okay. So for the probation department, the recommended budget is 200.5 million. It includes recommended actions for the Caltrans program services to adult clients, It recognizes the adult supervision revenue from SB 678 to help pay for current services, maintain current services, as well as shifting funds from their SB 823 Department of Juvenile Justice program. For the medical examiner corner, the recommended budget is 7.9 million, and this maintains their current level budget for next fiscal year. And that concludes the presentation of the recommended budgets for the criminal justice and public safety departments.
Thank you very much. And we'll go to supervisors first, allowing anybody who wishes to speak. When the supervisors are done, anybody from the public to register electronically in the interim. Supervisor Ellenberg.
Thank you. Mostly what I want to do is just share some appreciation. The only department I have a comment on is Department of Corrections, but 2020 was really a transformative year for public safety and justice reform. Our county committed to adopting anti-racist policies, enhancing equity across our services, and uplifting the voices of the community who have called on us to reimagine public safety systems. I appreciated in reading the budget and seeing that greater equity is really a theme across departments, and I'm excited particularly about some of the work in this policy area, including additions in the law enforcement integrity unit of the district attorney, the expansion of PAR teams in the Office of the Public Defender, efforts in pretrial services to divert wherever possible individuals from incarceration, innovations in the Office of Reentry that support continuing education, and of course, preparations in the probation department for the DJJ realignment that will enable us to provide services to youth with critical needs in their home counties. I want us to continue to find ways in which we can direct funding away from the carceral system to the behavioral health system of care, and reprioritizing funding away from systems that punish and increasing investments in services that seek to prevent harm and support healing. With regard to just the Department of Corrections, earlier in the custody health services budget that we discussed today, the department slated a $400,000 reduction in their budget for lab and pharmacy services due to a reduced inmates census. And if we're committed to maintaining a reduced inmate population across all of our facilities through the next fiscal year, which I hope we are, then I would expect there to be areas of opportunity where we might reduce costs across our additional opportunity where we might reduce costs across our correctional facilities. So I'd like to direct administration to provide a report as a part of the board questions that examines where we might reduce funding in jail operations in response to a reduced inmate census. And in particular, I'd be curious to know if there's opportunity to reduce costs in laundry and food services, as well as a survey of any unspent funds over the last fiscal year for programs that were put on hold due to the shelter-in-place orders. That is it from me on this one. Thank you.
All right, thank you. And not seeing any other supervisors' hands raised at the moment, we'll turn to our Supervisor Chavez and Semidian. Then we'll come back to the public.
I'm happy to wait till after the public comment, Supervisor.
Fine, let's do that then. Jill, if you'll please recognize our two speakers and give them 2 minutes each.
Sounds good. One moment.
Thank you.
Our first speaker is Sparky Harlan. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, this is Sparky Harlan, and I'm not only representing Bill Wilson Center here today, but the Collaboration for Juvenile Justice that's comprised of 30+ CBOs that work with young people out of juvenile hall. We have concern over how the Department of Juvenile Justice kids that will be returning will be served in our community. If you look at the probation's budget, there is a deduction of 1.6 million from the juvenile probation funding being replaced by the block grant for DJJ kids, and backfilling basically for probation officers that are being moved out of placement to serving these DJJ kids. There was a question about secure facility, meaning was the funding only to be used for custodial care in juvenile hall? That has been clarified by the National Center for Youth Law. Secure facilities can mean staff secure. An example is Office of Refugee Resettlement Facilities for unaccompanied minors. Staff secure is used as a term for detention of young people. So I urge you to look at how the CBOs want to return these young people for re-entry and housing into the community and not to be locked up for years in juvenile hall. If we can do it with our adult population, we should be able to do it with these young people. So far, Bill Wilson Center has housed 2 of these young adults, and I would tell you, they're no different than any other kid currently in juvenile hall. So please, let's be creative, let's be innovative, and look at services in the community for this population. Thank you.
Thank you, Sparky.
Our next speaker is Irvish. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much. I wanted to mention about, first of all, I want to thank you, Board of Supervisors, for the opportunity to comment. I wanted to mention about the SB 678 as the SB 678 that has been renovated in the month of February with statutes to provide the funding for providing the evidence-based practices and the supervision. It is to note here that when SB 678 was implemented, the Department of Finance legal view sees the funding that can be used for the existing and the new program as long as the funding is being utilized for the purpose of a probation officer, social workers, as well as health and mental health providers to utilize the programs effectively in order to place the policies, procedures, and program and practices designed to reduce the recidivism. Also, for the funds, which is being deposited as a revenue fund to the county, it is also, being monetized as well as, provide as a supplemental to implement the public safety services and the programs. Now, also as a part of a SB 23, that is also, being required to implement as to evaluate that, how, for example, taking the AB 1326, which was a 2017-18 legislative program, providing stricter punishment as a part of the juvenile system. Such program does help the county to implement and with the right policies, but also to provide the right set of funding for the program. Noting that the judicial system and juvenile system requires update on most of the occasions, the funding would help renovate such programs. Thank you very much.
That concludes our speakers, Mr. Chair.
Thank you. And I don't recall who came up first, so I'm going to go with seniority. Supervisor Simidian.
Thank you, Mr. Chair. I had just 2 items, and I can hold off on the second depending on where we are in the sequence. I just wanted to say briefly that on the modest additional increase in funding for the Public Integrity Unit in the District Attorney's Office, this is an augmentation that I had recommended at prior budget hearings in the past few years. We hadn't moved on it previously, but obviously this budget recommends that augmentation, and I was pleased to see it. It's something I support, so I'll just let it go at that. Then I do have some questions for the county executive about the sheriff's budget and the corrections budget. Would this be the right time, or would you like me to hold off until we have further presentations?
No, that's just fine. Thank you.
Thank you. Dr. Smith, we have discussed a series of law enforcement reforms at the Board of Supervisors, and they've been sort of arranged, packaged, formatted in different ways, but you will recall that almost a year ago now, I came to our board with what was really a package of about 15 different recommended reforms, the 8 can't wait package, plus 2 items that were designed to ensure compliance with state law as it had recently developed, plus another 5 items. And we have had some report backs from both county staff as well as our OCLIM contractor, the OIR group, about compliance. Progress has been made, but there were still some outstanding issues there. Could I ask, please, that we get a compliance update that is part of the budget presentation when the budget comes back to us for consideration and possible adoption in June, so that we know whether we are being asked to fund resources, activities, personnel, equipment that is or isn't consistent with those recommended policies.
Dr. Smith,
Yes, we will certainly do that.
thank you.
The next thing, Dr. Smith, is, and I want to be very clear, this is specific to the Sheriff's Department, the Corrections Unit. We have struggled, in my view, in years past with the fact that we allocate funding for one purpose, but then the day after the budget is approved, because we don't really have a line item budget in the traditional sense, funds can be reallocated by the leadership of the Sheriff's Department. Am I characterizing that correctly, Dr. Smith?
We budget into object level, so
Yes.
monies that are allocated towards personnel go in object 1 and service and supplies in object 2. If positions that are vacant stay vacant, that accumulated object 1 can be utilized for other object 1 purposes, such as overtime or extra help or other issues related to the operation. They don't necessarily have to be used for exactly the purpose that was intended.
Well, I want to express perhaps more clearly than ever my frustration that over the years we have been given assurances repeatedly that if we allocated funds for full-time positions, including in the academies, that we would have people in those full-time positions, that vacancies would no longer exist, and that the need for additional overtime would no longer continue. Those promises have yet to be realized, and at this point I have to say I've just given up expecting that they will be realized. So I'm anxious, candidly, about devoting money to positions or academy slots that a year from now we may well be told, unless there's a change, and I hope there is, but we may well be told, gee, sorry, couldn't fill the slots, and therefore we have once again used the funds for overtime and come back and ask for even additional overtime. And I have concerns about the misuse and abuse of the overtime, frankly, as well. Is there some way, if we had a board policy adopted simultaneous with the budget, to ensure / require that, at least within the Sheriff's Department and the Corrections Department, that if there was a majority of the board willing to do so, that as a matter of policy, the funds could only be expended if used for the purpose for which they were allocated?
Yes, you could do it by policy, not through the budget process, but in addition to the budget process, having a policy that was included in the budget, if that makes some sense. What I'm trying to say is you couldn't allocate at the line level, but you could have a policy that stated that specific object 1 funding had to be used for a particular object 1 purpose, like cadets or something like that.
All right, well, I think to the extent that this has been a recurring problem on a year after year basis, and it has, and I think to the extent that we are having these rather philosophical, sometimes quite disconcerting conversations about criminal justice reform, that it's time to ask ourselves, are we making that real, or are these just gestures? I really do feel that we got to step up and say, let's make sure we know how the money is being spent, that it's being spent in a way that is consistent with our avowed notions of appropriate reform, and that the funds are being spent for the purposes for which they're allocated. So to be continued. Thank you, Mr. Chair. I'll close with that.
Thank you. Supervisor Lee.
Let me try to unmute. Can you hear me now?
Now we can.
Great, thank you. My video on? Okay, good. Yeah, thanks for the very detailed report. We have a lot of really amazing information that has been shared. The issue we have one question on one of the remedial custody training on the sheriff's office. There was a request for training budget for the use of force policy, and also a training budget on mental health, and also a training budget for the first aid and CPR training. Apparently the request was a lot more, but I think the administration is only recommending a portion of it. Given how important these issues are in the use of force training, I mean, no less you turn on TV and not hear about some use of force problems we have from so many law enforcement agencies relating to mental health, and of course with first aid as well. Is there a reason why we are cutting them instead of granting what the sheriff's office is asking for?
Dr. Smith?
Merely because there's sufficient funds in the budget to do all of that training. So we're matching the size of the recommendation to the need.
Okay, so if it's enough, that's great. And for whatever reason, of course, if there's more need for this in the future, when we do a revise, we certainly want to make sure that the sheriff's office is not underfunded on these very important issues. Our staff was able to get a list of the amount of overtime cost, and what I've learned from the various business unit and overtime that we've seen from the sheriff's and the correctional deputy office. What's pretty amazing is that we're talking about over 426,000 hours of overtime was being charged for the fiscal year 2020, and that does not include training. Of that, some of the most huge numbers I see is like the sheriff's correctional deputy has over 287,000 hours of overtime, which becomes the FTE equivalent of like 137 FTE. Or another one is the deputy sheriff's. We have over 68,000 overtimes, equivalent to 32 FTEs. I'm raising those issues because obviously this is not the way to staff an office. We are way overworking our officers. Yet at the same time, the rate of overtime, of course, is at least time and a half or potentially 2 times based on the hours that they work, is extremely expensive and inefficient. I see that we are trying to increase 20 more FTEs for the cadets, right, to come into the office. So I have a bigger question really is, how are we able to get these overtime under control in the future? Or are we going to just, live off of overtime and continue this trend?
Dr. Smith?
Probably best for the sheriff to answer that question. It has to do with staffing patterns, which she can answer better than I can.
Madam Sheriff.
There are certain things that we do on overtime where we have instead asked for FTEs on certain things. That is overtime that we can control. We hope that we can see the staffing study so we can have adequate positions to staff actually the functions that are needed. Our staff in the past has been on mandatory overtime, which we entirely disagree with and believe that if the staffing is needed for a certain position, an FTE should be allocated. I'm very opposed to how we are operating many positions on overtime. If
Right,
that helps.
exactly. No, exactly. I mean, when I look at the situation, it says sheriff's correctional deputy under BU 235, BU 240, right? The total overtime hours came out to be 287,000 with a FTE equivalent of 137. That is those numbers are just so astronomical, right? I mean, it's clearly it's not operating properly. Something got to give on that. So if Sheriff, you might be able to come back and help us explain what type of FTEs we could do to staff properly, so that we could then reduce the overtime and also reduce the stress on the officers. They have to do these mandatory overtime, right? I think it's really a much better way to manage our organization. Don't you agree?
Yes, I do agree. Thank you.
Thank you. So yeah, if you could come back with some of those information, I would be interested to look at that to see how we could shift the funding around and make things more steady instead of try to do it through the overtime process, which is extremely expensive and not steady. Thank you.
Supervisor,
All right, let me see.
did you have another one, Supervisor Lee?
Yes, let me go to my sheet. I'm sorry, going back to different sheets here.
Sure. They're all in order this time.
Yes. And I think I'm just going to, my hesitation, just so everybody knows, I'm going through the questions, and some of them the staff has already answered, so I wasn't going to ask those questions again. I just want to make sure that those have been covered properly. Oh, and then one more was with the sheriff too, is maybe Dr. Smith can tell us, is regarding the cost associated with hiring the 2 FTE deputy sheriffs to provide the patrolling services along our favorite Sierra Road and the surrounding areas. As this issue has been, percolated for a long time, especially this year, and also if let me ask the question first. Can you let us know about that type of cost of the 2 FTE deputies?
We're working on that right now and considering it for recommended revision. I'm not sure we'll end up recommending it from the administrative perspective, but we're looking at it.
Great, thank you. And then the second question is whether you or the sheriff could provide information regarding the staffing needs to help work with the extremism or terrorism task force that we talked about.
We have
Sheriff
discussed.
will have to answer that. I'm not quite aware what you're talking about.
Go ahead, Sheriff. We believe that there is a need to have a more robust review of those types of organizations, especially since we're facing so much of the Asian hate right now. And I believe that we could do some outreach. We also see a lot of the right-wing extremists that is cause for concern right now. We don't have people specifically assigned to that. And I think that would be something that would be advantageous to the sheriff's office.
Thank you. All right. And I think that's, yep, I think that's all the questions I have for now. Thank you very much.
All righty, Supervisor Chavez.
Thank you all, and thank you for the work that you do for the county every day. Just a couple of areas that I wanted to highlight. One that I highlighted earlier as we were talking about the Child Advocacy Center, and that is that I am very interested in making sure that the Advocacy Center is fully staffed, and frankly, that we're not using overtime, but we're using direct staff, and I know Dr. Smith, this is something that you were taking a look at. I'm hoping that this will come back to us as part of the June budget. One was for 3 DAs and an assistant, so that we were able to cover the the weekends in particular, but also nights without using overtime. The other was 2 forensic interviewers, and I'm very interested in us getting those 2 forensic interviewers shared costs by the city of San Jose at least, and perhaps other cities, because those are resources that the entire community uses. That's true for the DA too, but I think the forensic interviewers are particularly important. And as I talked about under the medical side, we're really making sure we had the x-ray techs so that we didn't have children having to be moved to another location. And Dr. Smith, my question is really about timing. Is that coming back to us as part of the June budget, the final budget?
Yes, the DA and I and others were working on this through the month of May, and have worked out a proposal, but it was too late to get it into the budget book, so it'll be coming in June.
That's great. That's really good to know. And then the other issue that I'm really concerned about is that we had an attorney and an investigator that were assigned to work on domestic violence orders where victims of domestic violence had an order for guns or other weapons to be removed from the person who they were fearful of and who were committing acts of violence on them. That had an attorney and an investigator that was cut as when we had a dip in our budget, but I didn't see it get replaced. And I was curious about that also, Dr. Smith, as to whether or not there was a replacement strategy for those positions. I do want to just say one other thing about these domestic violence gun orders, that, you know, the number that we had that were not being covered in the county, those numbers are phenomenal. And this is really, from my perspective, as we're doing a lot of work to address domestic violence, this is one that we really can't ignore.
I think DA Rosen will have to answer how they're covering that need right now.
Thank you, Mr. DA.
We're doing our best to cover that need now, but we were hoping that in the CEO's, the county executives revised recommended budget, that we'll be able to add the attorney and investigator specifically to do this kind of work that this board had approved last year, but that we didn't have the funding for. So, you know, we're doing as well as we can with the resources we have. You know, recall, like, we're down 7% in terms of our prosecutor numbers because of the budget difficulties, as well as 5% of our overall staff. What that translates into numbers is we've lost 31 people through attrition, 14 of whom are prosecutors. So we're doing the most we can with what we have, but in terms of being able to effectuate those family court orders when the family court judge says the gun should be removed from the house, and for us to be able to go out and make sure that that happens, we would need an additional prosecutor and investigator to do that. We do think that's, as Supervisor Chavez pointed out, that's a gap right now in terms of being able to keep guns out of the hands of people that shouldn't have them at certain points because of a court order or mental illness or other issues. So we're hopeful that this will be in the revised recommended budget, and that we could then report back to the board in 6 months or a year as to our progress in making sure that these domestic violence orders are put into effect.
Supervisor.
Yeah, I was just saying, I apologize. I was looking at Dr. Smith's box to see if he was going to speak. Sorry about that. Jeff?
I'm just listening.
Well, on this one, you know, I'll just say this for my colleagues' benefit, that we had hundreds of these orders not being enforced, and part of the reason that we were even able to figure this out is that I think actually it might have been James Gibbon Shapiro who spent weeks and
Yes.
nights trying to put the list together to work with the courts and to do the coordination. And one of the challenges we have is that no individual police organization, frankly, is responsible for these lists as they get generated and then affirming that the lists are, that there's follow-up happening. And so what the district attorney's office did was, my recollection is that they followed up both with the police agencies and prioritized them based on, I think, on their initial assessment of risk, and then worked with the police agencies and or the district attorney's office to go secure the weapons. So I am very interested in getting this back into the June budget. I think it's a very high priority. And, you know, if it's not in the revise, I don't mind bringing it forward as a separate action for my colleagues, but I do think it's a core function and responsibility that we need to be taking care of, lest we see less people in the hospital and all the other places that we're seeing them. I have one last question, and this may actually be for you, Dia Rosen. I recall that when we were finalizing the strangulation pilot to make it not a pilot anymore and to make it countywide, as was the request of actually more than one of my colleagues, that on the strangulation pilot program that became permanent, that there was also a position in your office identified. Am I remembering that correctly?
I think that we haven't worked out yet with help with HHS exactly, you know, what organizations will get what positions to effectuate this. So, you know, the Office of Gender-Based Violence Prevention has existing contractual relationships with VMC to provide medical examinations with some community-based organizations. So I think we don't have a proposal yet to say this is how we're going to make sure that every victim of every domestic violence victim of strangulation gets this exam. But I think we were estimating along with HHS and the county executive that this may be around $750,000. And as to whose budget this is going to go into, I don't think we've worked out the details of that yet, but we hope to have a more robust budget for this, you know, soon. We're working on it.
Thank you. That I really appreciate it. I want to make sure that you know, the pilot was so effective. Frankly, I want to make sure that that we finish the work. But the other thing that I just wanted to say to Supervisors Wasserman and Semidian is that we also recognize these are services that we want to make sure are at St. Louis and in North County as well. And so I'm hopeful that when the budget comes back, it's reflective of that it mirrors the work that we're doing with our SAFE team and our SART teams, you know, that looks at a more countywide approach. So thank you, and thank you all for hearing my questions.
Yeah, just to echo that, Supervisor Chavez, just for the benefit of the board members, the reason it's so important to have medical examinations of strangulation is that there are often internal injuries which are quite serious, which you can't see externally. And strangulation is one of the highest lethality factors, meaning that a perpetrator who strangles a victim, that victim is at very high risk to be killed. So we always want to know when a victim was strangled, because that's such a high indicator of lethality. And these medical examinations have enabled us to see the internal injuries from strangulation, which may not be visible externally. Maybe a victim might be minimizing those injuries, but they're visible inside, and they're very powerful evidence for our prosecutions and for the protection of domestic violence victims.
Thank you very much. Supervisor Chavez, you had any other questions? No. Supervisor Lee, your hand is raised.
Yes, thank you. Yes, I missed the question for District Attorney. Good afternoon, Jeff. I noticed that there were 17 FTEs that were eliminated through the visa program. And with the adjustment we have right now, how is your staffing, and would you have enough to do what you need to do? Basically, is my bottom line question. And if there are additional needs that you might have that you want to share with us.
I think that the additions that we're talking about for the revised recommended budget, an attorney for the gun-related intelligence program, as well as an investigator, the attorneys and administrative staff for the Child Advocacy Center, an additional attorney and investigator for our plea team, public and law enforcement integrity team. I think those are good additions. It doesn't get us back to where we were before COVID. You know, we'd still be down probably 5%, not quite 5%. We'd probably be down 4% of our overall staffing. But you know, we'll make the very best use of the resources that the board gives us. And at this point, I'm not asking for additional resources. We're gonna do the very best we can with what we have. And if I feel at some point that we absolutely need another prosecutor or investigator to do X, Y, or Z, I'll certainly bring it to your attention. But you know, I know we all try very hard in the DA's office to spend the taxpayers' money carefully, effectively, and efficiently.
Great. Well, thank you. And I would also like to see if you'll be willing to help fund the what we call a gun buyback program that apparently was done about 2-3 years ago. And I think the question is, there's some fund from the asset forfeiture funds and all that, and how does that work?
Yeah, so we do have asset forfeiture funds. This is funds that we recover from basically the criminal proceeds, you know, criminals that are selling drugs or fraudsters or other kinds of criminals, and the proceeds of their crimes are forfeited to law enforcement agencies. And there's strict rules about how we can spend that money. We can't spend it to hire new positions for the DA's office, but we can spend it on efforts to combat gun violence. And so for several years in a row, we would co-sponsor a gun buyback with, I know the city of Sunnyvale, where you are from, is we sponsored a gun buyback with them. We've done that with cities in the South County and the North County in San Jose. And so we'd certainly be willing to do that again. And usually it's a matter of the DA's office puts up some of the money, the city puts up some of the money, and we do some joint publicity, and we're able to take, you know, a few hundred guns off the street, which is extremely helpful and important. You know, one thing to keep in mind is that there's a fair number of suicides and accidental discharges of guns, which lead to injuries, as well as guns that are stolen by criminals in residential burglaries. So for people who have guns that they don't want anymore, we're more than happy to take them off their hands.
Great. And we could talk more about that. And if there's any type of budget that general fund might need to supplement along with the asset forfeiture funds, I think that would be great to work with. Thank you. And my last question actually is related to the speaker who spoke earlier, Ms. Harlan, on this issue of what was the bill, SB 823, where the DJJ realignment is going to have more of the folks coming to our juvenile justice system potentially in the future. And I would like to find out from administration, maybe Dr. Smith, if you could let us know if anything that we need to do to adjust our budget to see if we could somehow create a type of a diversion program, as mentioned by Ms. Harlan, to support, which I think would make a lot of sense if that's something that is doable.
We'll work on it with Laura Garnett.
Great. And if you can have that brought back to us by the June hearing, that would be awesome. Thank you, Dr. Smith.
Okay.
Okay. And that's all I have. Thank you.
Thank you. And we have no more hands raised, nor do we have any more public speakers. That is the final item of, oops, Supervisor Lee, your hand's back up.
My bad. I never lowered it. That was my problem. Thank you.
Okay. You got
Thanks.
it. I won't say rook because that would be inappropriate. All right. That does conclude all the items on our agenda, supervisors. Is there anything else that you wish to share? Otherwise, we're going to recess today's meeting until tomorrow at 1:30.
Thank you.
Seeing and hearing
Thanks all.
that, hope you all have a good evening. Take care.
Thank you.
Thank you.
Thank you.
And the room will now be closing.